Hey everyone! Welcome back to the channel. Today, we're talking about a condition that affects millions of people around the world: varicose veins. Those bulging, twisted veins you might see on someone's legs aren't just a cosmetic concern, they can sometimes signal deeper health issues too. So, what causes them, who's at risk, and what can you do about them? Let's break it all down. Definition. First things first. What are varicose veins? Varicose veins are enlarged, swollen, and twisted veins, often appearing blue or dark purple. They usually show up on the legs and feet because standing and walking increases pressure in the veins of your lower body. They may look like ropes or cords running beneath your skin, and in some cases, they're accompanied by aching, heaviness, or discomfort. Causes of varicose veins. Now let's talk about why they happen. Your veins have tiny valves inside them that help keep blood flowing toward your heart. But when these valves become weak or damaged, blood can flow backward and pool inside the vein. That extra pressure causes the veins to stretch and bulge, and that's what we call varicose veins. Over time, they become more visible, especially if the surrounding muscles and vein walls are weak. Risk factors. Wondering who's at risk for varicose veins? Let's go through the major risk factors. Age. As you get older, your veins naturally lose elasticity and the valves may weaken. Gender. Women are more likely to develop varicose veins. Hormonal changes during pregnancy, menstruation, or menopause can play a role. Pregnancy. Increased blood volume and hormonal shifts during pregnancy can enlarge veins, especially in the legs. Genetics. If varicose veins run in your family, your chances go up. Obesity. Excess weight puts extra pressure on your veins. Standing or sitting for long periods. Occupations that involve long hours on your feet, like teachers, nurses, or cashiers, can increase your risk. So yes, lifestyle, genetics, and even hormones can all work together to bring on those pesky veins. Signs and symptoms. What do varicose veins feel like? Not everyone with varicose veins has symptoms, but for many people, they can include a heavy or achy feeling in the legs, burning, throbbing, or cramping muscles, swelling in the lower legs, itching around one or more of the veins, skin discoloration, especially near the ankles, increased pain after sitting or standing for a long time. Over time, untreated varicose veins can lead to complications like ulcers, blood clots, or bleeding. Diagnosis of varicose veins. Now, how are varicose veins diagnosed? It usually starts with a physical exam. Your doctor will look at your legs while you're standing to see if there's any swelling or bulging. They may also ask about your symptoms and medical history. In some cases, a test called a duplex ultrasound is done. This helps visualize blood flow in the veins and check for any blood clots or valve problems. It's painless and helps confirm the diagnosis. Management of varicose veins. Good news: there are lots of ways to manage varicose veins. Let's begin with lifestyle changes. These are great for mild cases or preventing new ones. Exercise regularly, especially walking. Elevate your legs when resting. Avoid long periods of standing or sitting. Maintain a healthy weight. Wear loose, comfortable clothes. And avoid high heels. Go for flat shoes when possible. You can also wear compression stockings, which gently squeeze your legs and help veins and muscles move blood more efficiently. They're especially useful if you stand or sit a lot. Treatment. When lifestyle changes aren't enough, there are medical treatments too. Here are some of the most common options. Sclerotherapy. A solution is injected into the vein, which causes it to scar and collapse. The vein fades over time. Laser treatments. These use bursts of light to close off small varicose or spider veins. It's non-invasive and doesn't require incisions. Radiofrequency or endovenous laser therapy. A catheter is inserted into the vein, and heat is used to seal it shut from the inside. Vein stripping and ligation. This is a surgical procedure where larger veins are tied off or removed. It's used less often today due to less invasive alternatives. Ambulatory phlebectomy. Tiny punctures are made in the skin to remove smaller veins near the surface. Recovery is usually quick. Your treatment depends on how severe the condition is and whether it's causing other complications. Common myths about varicose veins. Let's clear up a few common myths about varicose veins. Myth: only old people get varicose veins. Truth: while they are more common with age, younger adults even in their 20s can get them too. Myth: varicose veins are just a cosmetic issue. Truth: they can be painful and lead to serious complications if not treated. Myth: you should avoid exercise if you have varicose veins. Truth: exercise actually helps improve circulation and can reduce symptoms. Myth: crossing your legs causes varicose veins. Truth: there's no solid evidence for this. The bigger culprits are genetics, hormones, and long-standing pressure. Living with varicose veins can be frustrating. They can make you self-conscious, and for some people, the symptoms can affect daily life. But the good news is you're not alone, and there are effective treatments. The key is early recognition and management. Don't ignore the signs, especially if you are in pain, noticing changes in skin color, or dealing with persistent swelling. Conclusion. Alright friends, that wraps up our deep dive into varicose veins. If you learned something new today, give this video a thumbs up, hit that subscribe button, and ring the bell for more health content every week. And tell us in the comments, do you or someone you know struggle with varicose veins? What has helped you the most? Thanks for watching, and remember, your health is your wealth. Take care and see you next time.